Hello students, I am Dr. Sowndarya from the Department of Pediatric and Preventive Dentistry, Vinayaka Mission Sankaracharya Dental College. So today we'll be seeing about child psychology. In child psychology, I'll be dealing in detail with psychosocial theory, theory of developmental tasks and theory of cognitive development. Starting on with psychosocial theory, it's also called as the theory of developmental tasks. So, psychosocial theory was introduced by Erik H. Erikson, who was a Danish German American who was also a developmental psychologist and psychoanalyst, and he was known for his theory on social development of human beings, and he was also famous for coining the word identity crisis. Psychosocial theory was proposed by Erikson in 1950 in his book named Childhood and Society. This theory postulates that society, who responds to a child's basic need and or developmental task in a specific period of life, and in doing so, society ensures child's healthy growth and survival in culture and traditions. So according to Erikson, each individual passes through 8 developmental stages, starting with preschool, school age, adolescence, young adulthood, middle adulthood, maturity, infancy. Infancy is starting from the age 0 to 1, toddler is age 1 to 2, early childhood is age 2 to 6, and elementary and middle school years are age 6 to 12, and adolescence is age 12 to 18. So stage 1 is called infancy, that is age 0 to 1. So the crisis basically faced during this stage is trust versus mistrust. In the first year of life, infants depend on others for food, warmth and affection, and therefore they blindly trust the parents or caregivers for providing these. So the dental application mainly is separation anxiety. So if it's necessary to provide dental treatment at this early stage, it is preferable to do so with the parental presence, and preferably with the parent holding the child. Stage 2 is called toddler, that is age 1 to 2. So the crisis faced during this stage is autonomy versus doubt. So children around age of 2 are often said to be undergoing terrible twos because of their uncooperative and frequent obnoxious behavior. So the dental application is the child is moving away from the mother but still will retreat to her in threatening situation as such a dental clinic. At this stage, as the child takes pleasure in doing tasks by himself, a dentist must obtain cooperation from him by making him believe that the treatment is his choice and not the dentist or the parents. Offer reasonable choices whenever possible. For instance, ask the child whether he or she wants a green or an yellow napkin, and the child would feel if it's her choice and the child desires it. Stage 3 is early childhood stage, that is age 2 to age 6. So the crisis faced during this stage is initiative versus guilt. Children have a newfound power at this stage as they have developed motor skills and become more engaged in social interaction with people around them. And they now must learn to achieve a balance between eagerness for more adventure and more responsibility, and learning to control impulses and childish fantasies. As far as dental application is considered, a child at this stage will be intensely curious about the dentist's office and eager to learn more about things out there. Success is coping with the anxiety of visiting the dentist can help develop greater independence and produce a sense of accomplishment. Poorly managed, of course, a dental visit can also contribute towards guilt that accompanies failure. An exploratory visit with little work is often a good way to start the dental treatment. Stage 4, elementary and middle school years, that is age 6 to age 12. The crisis faced during this stage is industry versus inferiority. Erikson describes industry as a sense of being able to make things and make them well and even perfectly. Child develops industry by learning new skills and takes pride in the things made. At the same time, if the child is unsuccessful and is allowed too little success either due to harsh teachers or rejecting friends, he or she develops a sense of inferiority or inadequacy compared to the schoolmates. As far as dental application is considered, children at this age are trying to learn the skill and rules that define success in any situation, and that includes the dental office. This means emphasizing how the teeth will look better as the child cooperates is more likely to be a motivating factor than emphasizing a better dental occlusion. Stage 5. Adolescence. This is from age 12 to 18. The crisis faced during this stage is identity versus role confusion. Adolescence represents the final transition between childhood and adulthood. It's an extremely complex stage because of many new opportunities that arise. Members of the peer group become more important role models, and values and tastes of parents and other authority figures are likely to be rejected. Dental application. Any orthodontic treatment should be carried out if the child wants it and not as parents at this stage. Parental authority is being rejected. Approval of peer group is extremely important at this stage. It's extremely important to realize that the treatment is being done for him and not to him. For example, orthodontic treatment has become so common that there may be a loss of status from being one of the few in the group who is not receiving the treatment. So the treatment may even be requested to be remain one of the crowd. So that's it with psychosocial theory. Now moving forward, theory of cognitive development. Cognitive development was put forward by Jean Piaget, who is the world's leading theorist in the field of cognitive development and proposed his theory in 1952. So, Jean Piaget believed that as a child grows, he is required to adapt according to people he is living with. These all stages can be grouped as follows: schema, accommodation, assimilation and equilibrium. Schema. The information we already have stored in our brain is called schema. Children are active thinkers, constantly trying to construct more advanced understanding of the world. These understandings are in form of structures, hence called schema. Assimilation. Interpreting a new experience within the context of one's existing schema. So the new experience is similar to other previous experience, that is assimilation. Say for example, the child has a understanding that any animal with 4 legs, 1 tail and a head is a cat. So that is a schema that we have provided to the child. Existing information in the brain. Assimilation is when the child is going to look at a dog in a park and think, oh, this dog also has 4 legs, 1 tail and a head, so this is cat. So that is when we come forward and correct the existing schema, that is called accommodation. So we teach the child that is not a cat, that's a dog. So dog also has 4 legs, 1 tail and 1 head. So that is called accommodation. So equilibrium is when a child properly identifies a cat or a dog when he looks at one. So this state establishes as a result of new knowledge to the child. As children progress through stages of cognitive development, it is important to maintain a balance between applying previous knowledge, that is assimilation, and changing the behavior to account for new knowledge, that is accommodation. So Piaget marked 4 stages of cognitive growth, each characterized by a different type of thinking, and in each the child relies more upon internal stimuli. So Piaget's stage of cognitive development was divided mainly into 4 major groups: sensory motor stage, pre-operational stage, concrete operational stage and formal operation. And pre-operational stage was further divided into preconceptional and intuitive stage. So we'll see in detail about sensory motor period, that is from birth to 2 years of age. During the first 2 years of life, a child develops from a newborn infant who is almost totally dependent on reflex activities to an individual who can develop a new behavior. Dental application. Children at this age react strongly to taste and smells of dental materials like latex gloves, whose smell and taste are unfamiliar. Resin used for restorative materials such as composite, glass ionomer and sealant have strong smells, and it's important to consider smells and tastes and familiarize the child with the smell prior to working into the oral cavity. Pre-operational period is from 2 years to 7 years. It's called the transition period. Manipulation of symbols or words is a characteristic feature of this period. Children tend to perceive that the world from their own perspective, as that they are egocentric. So pre-conceptional period is from 2 years to 4 years. The child's mind acquires the ability to think symbolically with mental imaginary. During this phase, the child can play and fantasize using mental symbols, but still generalizes all entities. Intuitive stage is from 4 years to 7 years. A child in this age knows how to behave in social situations, for instance while playing, and are able to solve simple problems before reasoning, and thereby this stage is referred to as intuitive stage. However, his understanding is still based largely on what he sees. Dental application. Pre-operational child will have trouble in understanding a chain of reasonings like brushing and flossing to remove the food particles, which in turn prevents bacteria from forming acids, which prevents tooth decay. But in the stage, he is much more likely to understand brushing makes your teeth white, clean and smooth. The 5 main areas of focus in the stage are constructivism, cognitive equilibrium, animism, centering and egocentrism. Starting with the first one, the child likes to explore things and make own observations. For example, the child likes to explore things and the dental chair and the airway syringe. Cognitive equilibrium is when the child is explained about equipment or an instrument and allowed to deal with it. Animism is when the child correlates things with other objects that they are more used to or accustomed to. For example, the handpiece can be called as a whistling whistle, who is happy when he works at polishing the child's teeth. Centering. During the treatment, the child could be given a hand mirror to look into it. The child should be directed to focus the attention to the mirror or watch the treatment on rather than concentrating on what's happening. Egocentrism. When the children exhibit egocentrism behavior, they become difficult to treat, as young child can get startled by the chair moving backwards. So it is advisable to have a chair in a supine position in the beginning of the appointment itself, or have the dentist call the ride as spaceship ride. The dental team should be prepared to manage disruptive behaviors. For instance, the dental assistant should passively place his or her arms slightly above the arms of the patient during the injection. In this instance, the assistant is prepared to hold the child's hand if he or she attempts to grab the dentist. Concrete operational period. This period starts from 7 years to 11 years of age. As child moves into the stage, typically after a year or so of preschool or first grade activity, an improved ability to reasoning emerges. She can use a limited number of logical processes, and especially those involving objects that can be handled or manipulated. Important processes during these stages are serration, transitivity and classification. The ability to sort objects in an order according to the size, shape or any other characteristics. For example, if given different colored shaded objects, they make a color gradient. Transitivity is the ability to recognize logical relationship among elements in a serial order and perform transitive references. Example, A is taller than B, B is taller than C, and A must be taller than C. Classification. It's the ability to name and identify set of objects according to appearances, size or other characteristics. Decentering, where the child takes into account multiple aspects of a problem to solve it. Reversibility, the child understands numbers or objects can be changed and then returned to their original state. For this reason, a child will be able to rapidly determine that if 4 plus 4 equals 8, 8 minus 4 will equal 4, original quantity. Dental application. This is your retainer. Place it in your mouth like this and take it out like this. Put it every evening after dinner before you go to bed. Take it out every morning before breakfast. Brush it like this. Keep it clean. children will understand. Children in this group will understand the instructions that you give. Children in this age group are specially receptive to play and humor. Modeling techniques and reward therapy is appropriate behavior in dental environment, and praise is a strong reinforcer. Formal operational stage. Finally, from 12 years onwards, formal thought is perfected and its grouping characteristics like complexion of reflecting intelligence. 4 abilities are developed during this stage, that is ability to reason relationship between propositions, ability to consider and use all possible disjuncts and combination, ability to inverse and reciprocal in a single system, ability to understand action and reaction. At this stage, the child's thought process has become similar to that of an adult, and the child is capable of understanding concepts like health, disease and preventive treatment. Aesthetic corrections can be done during the stage. To conclude, as pediatric dentist, we must tailor the dental appointment individually for every child and adolescent, focusing on the individual strengths. Children and adolescents differ greatly in physical, psychological and dental growth. The more a child trusts the dentist, it is easier to perform the treatment. Thank you students for listening to my class.